So welcome to our first of our monthly Connect Lunch and Learns. So this is really an opportunity for all of the Connect users and potential users to just kind of get to know each other, who's on the system, and be able to build relationships. That's one of the things that we hope Connect can do, is to help providers, break down silos and build relationships. And so I wanted to give you all a chance to get to know who you're sending referrals to. So this is the first one. We're focusing on services for kiddos today, and we'll rotate through kind of the various subsectors throughout the month. Suggestions are welcome. I've been trying to just categorize more broadly. So again, I think I know all of you looking at the features here. So this is Julie. I'm the Connect Coordinator at Public Health. So focusing here on kid sections, I'm going to turn my video over to Mary Pierce, who's the home visiting supervisor here at Lewis and Clark Public Health, and she'll be talking about her programs very briefly.
Hey guys. Hey Dave. If you can hear me. Here at Lewis and Clark Public Health, we have several home visiting programs, so I'm going to try to make this as brief as possible. We have the Parents as Teachers program, the Nurse Family Partnership, the Montana Asthma Program, Circle of Security, First Breath, which is a smoking cessation program for pregnant women. And we have a peer breastfeeding counselor that can work with women who are preparing or are currently breastfeeding. So I'm going to focus mainly on the Nurse Family Partnership right now, because that program we're still looking for new enrollments. Our two nurses that are employed here at the health department can see first time pregnant women before the age, or before 28 weeks gestation. They also have an income requirement that is, they have to meet WIC eligibility requirements. So it's above Medicaid, but not a whole lot above Medicaid income requirements. So either they have to be first pregnancy, 28 weeks gestation, or if it's a second or third pregnancy, it can be any time during their pregnancy that we can connect them with a nurse home visitor. And those home visitors can visit with families up until the child is age 2. Then we can typically move them into a different home visiting program if that is requested and desired. We are also looking for referrals for our First Breath smoking cessation program. So that is for women who are pregnant and want to stop smoking. It can be vaping or any tobacco use in the home around pregnant women. I can also work with the family members that may be smoking around the pregnant woman. But the pregnant woman has to be the enrolled person, so they would have to be using tobacco in some fashion. I can also work with those families up until the child is 3 months of age, so we can work on their desire to quit smoking. Okay, so I'm going to leave it at that, just because I could go on for a long time and I want to give everybody else their chance. So thank you.
Great, thanks, Mary. All right, let's turn this over to Angela Nelmark from Family Outreach. Angela, if you can just unmute yourself and you'll be good to go.
Can you hear me? Hello.
Yep, we can hear you.
Okay, good. So I'm Angela. I'm the Support Services Supervisor here at Family Outreach in the Helena Children's Services Office. And I'm also here with Erin, who's our Intake Coordinator. And Family Outreach overall provides services to kids and adults with developmental disabilities or delays from birth through the lifespan. We have offices here in Helena and then as well as in Butte and Bozeman. I'll let Erin talk a little bit about the program specifically.
The first program, one of the programs we have is the Part C program. It's for children from birth all the way up to the age of 3, and it's an in-home-based intervention services. In-home-based intervention service. We provide resources, supports, ideas, strategies to for parents to help them support their child if the child shows developmental delays or disabilities. And then prior to the age of 3, we help them transition out. We help them start transitioning out of services, whether it's into a special education preschool or other preschool services. One of our other programs is the Family Education and Support Program. It's for children from age of 3 all the way up to 21. And it looks very similar to Part C, providing resources and support in the home for parents to help them support their child. And past the age of 8 to qualify for this program, that's also required that they have DD eligibility. And one of the last programs we have is for autism insurance services. We provide ABA therapy for children who have an autism diagnosis, and we provide those services in a clinical setting, in the home, or in the community.
I think that's a pretty good overview of what we do, but we take any referrals, so from anyone, you know, it doesn't have to be a doctor or anything, it can be the parents themselves, or so I think that's important to know.
Therapists, daycares, anybody, yeah.
Great, thank you, Angela and Erin. We had a question come in asking if the services are available to anyone or if it's just Medicaid, and I'll let you answer and then I'll turn it over to Mary to answer for hers.
The services are available to anyone. For the Part C program, it's an entitlement program, so there's no wait list for services. Anyone who wants a slot and qualifies for the program will get a slot. With the FBS program, there is a wait list for services, but if they qualify, they are put on the wait list, and I try to help them refer them out to other things as well.
Great, thank you. And for Mary's program, I'll let her.
So the question was, are these child services available to anyone or just Medicaid? For the health department, it depends on the program. A family would have the income requirement for nurse-family partnership. That is not necessary for the Parents as Teachers program. There are other priority areas that we look at, but it doesn't have to be eligibility. For Montana Asthma Program, there is no Medicaid requirement or income requirement. Circle of Security is open to the community. Anybody can come into that one. First Breath is also anybody in the community. And the peer breastfeeding counselor is available to those who are WIC eligible. So they do have to be WIC clients for that one. So hopefully that answers the question.
Great, thank you. And next, let's have Amanda Steichen from Florence Crittenton speak about your work.
Hello, I'm Amanda Steichen, and I'm a Parents as Teachers home visitor with Florence Crittenton. We focus on 3 priorities. During the visits, we focus on parent-child interaction, development-centered parenting, and family well-being. My clients directly come from Child and Family Services, but Michelle Flemings and Katie Meslowski are also Parents as Teachers home visitors, and they can pretty much see anybody. And there are priority populations, but they don't have to be Medicaid families. So, yeah.
Great, thank you.
Great, thank you.
So I want to touch a little on mute Amanda. So I want to touch a little on what's happening on the Connect side of things, and I'm just going to open up for questions. So I have a lot of things are coming. So we have a new user guide coming that will dive into lots of details on the various screens that you see in Connect. The reports are being updated, and more information on that will be coming. If you or anyone else at your agency has questions on reports in the meantime, just let me know. We have a demo system available that anyone can access now. I'll be sending the information about that soon. But if anyone wants that, before that gets sent out, feel free to just shoot me an email. And then you may have seen that the naming conventions look a little different. They're in the process of getting standardized. So things will all make more sense. So give that about a month or so, and we'll be able to get that straightened out. So that's kind of the news from the Connect side. And I want to turn this over for any questions and anyone else who wants to talk a little about their programs. I think we have a small enough group that if we want to do kind of round robin of intros, that would be anyone who wants to jump in and share a little about where they work and what's happening. That should be good. I want to keep these kind of lunch and learns to about half an hour for our once a month, but so I've got a bit of time if anyone else wants to introduce themselves and share about their work.
This is Amber Rogers from Mountain Pacific Quality Health, and I just have another quick question. I heard I'm part of the group here in Missoula, and I heard that there is now the ability to refer across county lines. And I'm not really sure of what kind of programs I can see if you live kind of on the edge of a county, how it might be more convenient to go to a different county than your county that you actually live in. But are there specific resources at the state versus more just local referrals that would be very important to get connected to Connect across county lines? And I'm thinking specifically because you guys are in Helena, those state resources.
Thanks, Amber. That's a good question. I'm not sure about the state resources and county. In general, the state resources are up and coming. They will be on Connect, hopefully in the near future. As far as the intrastate referrals, it's great for anyone who's transient, anyone who's moving, anyone who's looking for a specialist and that may be located in another part of the state. And then we've got a bunch of telehealth, telepsych folks coming on as well. So for those patients, they'd be staying in their area, but you'd be able to send the referral to, say, a telehealth therapist who's based here in Helena or who's based in, Kalispell, for instance. And that's another opportunity that this allows. And so I think and then for any college students or anyone who may be going home for the summer or, kind of other movement throughout the state, this helps reduce those silos. Who else wants to jump in and share a little about what their agency is up to? I'm going to invite Amber Kreis from, I think, if my memory serves, Child Care Connections to share a little if she's available.
Sure. So yes, I'm Amber Kreis. I am the Family Engagement Coordinator with Child Care Connections. And I'm based out of Bozeman. We serve Gallatin, Park, and Marr counties. And we also have a Helena office, so obviously Lewis and Clark. We also serve Broadwater and Jefferson counties. Christy is also joining us. She is an eligibility specialist, and Christy Fairster can talk more to that side of things with the Best Beginning Scholarship TANF and helping families find if they're eligible and affording childcare. My role with the family engagement coordinator piece is mostly helping families find and establish quality childcare and sending out referrals that fit their needs and that obviously are things that they're looking for and in their area and are quality childcare settings. I also work to do community resource and referrals, obviously trying to help a lot with vulnerable populations, so homeless, low income. Obviously, too, we help with, if we have families that are identified with children with special needs, then helping, again, refer out and utilizing like, obviously local resources, some that are obviously on here as well, like family outreach, things like that, and then helping them afford potentially care on top of their Best Beginning Scholarship for additional services for their children with special needs or disabilities through the state. So I kind of help walk them through that. Yeah, I will let Christy talk about her part as far as eligibility and the scholarship and that.
Thanks, Amber. Christy, are you available to share a little? All right, let's see who else may be online here with us. Looks like we've got Kathleen Miller from Career Training Institute. Kathleen, if you're with us, would you like to share a little about CTI? Or I'll just open it up. Seems people may be stepping out. I'll just open it up for anyone else who'd like to share. I think we've got Helena Pediatrics, we've got Montana Legal Association, we've got I think a few people from St. Peter's. You'll all be welcome to share about what you're up to. All right, I think we will get these folks to introduce themselves in the future. So thank you all so much for being here. And I will be in touch with details about our March session and with a little more information. We're due for another email about the new agencies coming on Connect, and I'll be sharing all that in this recording next week. So if there are any other questions, feel free to email me. I'm happy to help get you in touch with the right folks. Thank you all and happy Friday.
Thanks, Julie.
Thanks, Julie.